Okay, let's talk about the future of healthcare in terms of technology. There's a convergence of technologies that will radically change the industry. Let's just go through this slide deck, and got a couple of videos in here too as well. So the Internet of Medical Things, similar to the Internet of Things, is rapidly growing. The way you have Wi-Fi connected thermostats and cameras and lights in your home, medical devices are going in the same direction for wearables and other items in your home that will connect to the internet. 5G, different than 4G, very different. We'll look at the differences. Can handle massive speed and capacity, much different than 4G. And blockchain, which is used in Bitcoin, ephemeral, various cyber coins. It's the underlying technology that supports it, very secure, very scalable. That will be used in healthcare and other industries as well. And if you look at all the data we're collecting, it's going to be able to feed artificial intelligence, real-time AI. So this convergence is going to radically change healthcare. So let's first look at the Internet of Medical Things, or the Internet of Things that relate to medicine. I could change this slide every day and not keep up. There's a cornucopia of vendors that are involved in the Internet of Medical Things, trying to create sensors for your body. And here's just a small sample. Digital contact lenses that can look at your pressure of your eye or give you better night vision they're working on. This is very interesting, this electronic digestible. It's a way to sort of indicate and record when you do take your medication. So an older person who forgets, they're not sure they took it, the digestible, as the pill digests in your stomach, it sends a signal to the phone, and your iPhone obviously can communicate with the provider or family members and let them be aware that they took too many medications or not enough medication. And it's a really good way to create a real, very empirical medical medication record for the patient. And then there are various inhalers that can do calculations for you in terms of what's happening with your lungs and the pressures and the amount of oxygenation. And then you may have seen this on TV, I'm sure, these little EKG devices that work with your smartphone for like $100. So there are sensors on your wrists, there are rings, there are things that go on your body. Again, it's changing really month to month in terms of the amount of devices that are out there, what you can get. But just be aware that this is a rapidly growing sort of sub-industry of the Internet of Things for medical technology. And of course, the Internet of Medical Things will talk to the Internet of Things, and just sort of a little joke, but I'm sure we're going to see these kinds of connections where the woman here says, bad news, the scale is threatening to cut off my access to the fridge. So the devices will be talking to each other, and that's one of the benefits of 5G. 5G has the capability to really consume all of this data on a real-time basis in a very scalable way. We'll look at that in a few minutes. Providers find that getting alerts from electronic medical records is very helpful. Over 51% really think that they're very useful. So there is benefit to an electronic medical record or a health record sending information to providers. They do see it as a benefit. Very few see it as something that they don't think is important. But can you imagine if the biometrics from your body can be collected in an EMR, an EHR, electronic health record, electronic medical record, to let a provider know when your things are happening with your blood pressures or your temperatures, something with your biometrics is trending the wrong direction, and that information can go to a medical record. And of course, there's got to be some sort of integration with the EMR, and it's happening now. But of course, there are challenges. There are lots of different devices, but that is being worked on, and that is being worked out with some consortium of manufacturers who are looking at creating standards for this to make this even easier. So lots of opportunities in the spectrum of your health, whether it's ambulance care, follow-up care, preventive medicine, just continuous monitoring, diagnosing, treating, deploying medications to your body. And then the other interesting thing is this emergency room sort of concept, or ambulance, I should say. Someone might be experiencing a stroke or a heart attack. A code blue could be sent out to your provider, and your location could be sent as well. So there's lots of ideas that are coming up now that the various entrepreneurs are figuring out ways to deploy the Internet of Medical Things in a way that can keep you healthy and help you when you do have an event. Now, as far as clinical trials, collecting information from a patient in a sort of automatic way with the Internet of Medical Thing will increase the number of, or I should say decrease the number of failed clinical trials. So about 80% of clinical trials for new medications fail or are delayed because they can't get enough subjects, patients who are willing to participate. And there's probably only about 5%, this is again according to IBM Watson, about 5% of all the eligible patients who could be in a clinical trial participate. But now it'd be a lot easier to solicit patients for clinical trials if the device, if there's an Internet of Thing or an Internet of Medical Things on their body that's collecting some biometrics for them, so they don't have to have the onerous task of recording this themselves. The machine's recording it for them and sending the information to the provider. So it should be easier to solicit more participation in clinical trials. And of course, the other thing is you're not getting someone, you're not counting on someone doing this in a routine way, continuous way, that they're manually recording their information. You're getting empirical data from the device. It's not going to forget to take the measurement when it's supposed to take it. It's going to take it accurately. It's not going to be forgotten the way a human might forget in a clinical trial. So these are advantages for clinical trials, ways you can deploy the Internet of Medical Things for clinical trials. Now, of course, the Internet of Things and the Internet of Medical Things is going to overwhelm 4G. The growth is really astronomical. But 5G is on its way, and it's going to take care of this problem for us. So 5G compared to 4G is very, very different. 4G is about 15 megabits per second. 5G is 1 to 10 gigabytes per second. So it's very, very fast. It also can handle high density. Within 1 square kilometer, it can handle up to 1 million nodes, 1 million devices sending information to the tower, to the cell tower. And lots of data. Those million nodes could send up to 10 terabytes of data, and the cell will be able to handle it. So it's fast, high density, lots of capacity. And it'll also support device-to-device communication because of the ability of this 1 million nodes per square kilometer. So lots and lots of density that can be consumed by the 5G towers. So 5G, this chart to the right's a bit busy. Let's look at some bullets. Fast for uploads and downloads, no latency, no delays. It accommodates, as we said, a vast number of devices. You could be on a train or a plane going, well, maybe not a train, but a plane going 500 kilometers per hour and still stay in connectivity with 5G. Lots of capability for machine-to-machine communication, low cost per transmission, and the ability to give your device requires less power to communicate with 5G. So better battery life for your devices. So looking quickly, the top 2/3 of this chart talks about 4G and 4G macro cells, very big towers that you see around town, can communicate 75 to 400 feet. Smaller cells that you might see on top of telephone poles or lights, and they can't communicate obviously as far, but maybe 30 to 60 feet. So that's sort of the network for 4G. 5G is a bit limited in the sense that 5G, and I put a little green star here to kind of zero in on it, can only communicate about 250 to 750 feet with a tower that's 30 to 60 feet. I'm sorry, I probably said it a little bit earlier incorrectly. This is the tower height here in the center of this chart, okay? And these arrows here tell you how far it can communicate. So 4G, as you can see, can communicate a lot further than the 5G 250 to 750 feet with a tower that's 30 to 60 feet tall, not very tall. So you'll need a lot of these towers because 5G can't get, it doesn't have the capability of being on a very tall tower for up to 400 feet and communicating 20 miles. So you'll need many, many 5G sort of mini towers. So it might take 5 years, some of the estimates, for 50% of the United States to be covered with 5G. And devices will automatically switch back and forth between 4G and 5G. And these devices are available now. You may even have a phone in your possession that can do this, and you may not be aware of it. So let's talk about blockchain. Blockchain technology, again, so we talked about the Internet of Things, right? We talked about 5G, being able to handle all that data. Now let's talk about security. Blockchain is the underlying technology for Bitcoin, ephemeral, various cybercoins, but it can be leveraged by other industries. So just about every industry that's out there, particularly the financial services industry, the banking, are beginning to use 5G for their own internal processes because it's scalable and it's very secure. It ensures data integrity, very efficient. So let's take a look at where else it could be used in healthcare. So if you have that kind of security, with a blockchain, you can create a comprehensive electronic medical record that includes all the history from all the health systems the patient may have gone to. The patient also has better control over who sees his or her medical records. And again, it's very secure. Very rigorous chain of custody for pharmaceutical ingredients. There have been problems with raw materials coming out of China that don't have the right efficacy, or they have contaminants in them. You can go back using the blockchain technology, go back to the actual source batches and understand where they came from specifically, so you can sort of correct your supply chain and not have these ineffective drugs be manufactured. Smart contracts for medical supplies, again, very secure capability and lots of the scalability with blockchain. Providers that do credentialing, hospitals, I should say provider organizations, hospitals, insurance companies have to credential their providers. It would make this administrative task much more secure and easier to do in a more automated way. As far as international disasters, you'd have the same situation with transactions, trying to locate human capital, people, the right specializations, and supplies for emergencies. So you can see that because it's secure, it could be used in all these different sort of processes in healthcare, in the healthcare industry. So let's look at blockchain a little bit. So transactions, whether it's a financial transaction or a medical record transaction, each transaction gets sort of a total. It's called a hash total. Every data element in that transaction, a name, a date, a dollar amount, a blood type, a lab value, whatever it is, gets all added up and bundled into what's called a hash total. These transactions get bundled up together into batches and then get stored in a block in this blockchain. But the very unique thing is each block has its own hash, but it has a hash of the previous block. So block 50 here has a hash for its transactions, but it also has the hash of block 49, hence the chain. So it's very difficult to change any one block because it throws all the subsequent blocks off. So when the system goes to recalculate the hashes, they'll know that all these subsequent chains are wrong. The hash totals are wrong. So for someone to tamper with it, to change the integrity, change a dollar amount or a value in this block is very difficult because you have to then go change all the blocks following that. So that's why it's like each link, that's why they call it chain, is connected to the next one so that the values are all connected in this way of keeping the hash total from the previous block. And the other thing that's unique about blockchain is that it's distributed. There isn't a centralized bank. It's additional like a centralized bank or storage area for the ledger of transactions. Everyone participating in the network has a ledger, a copy of the ledger. So everyone's got a copy of the chain. So each chain, the values are all connected on the chain. The hashes are connected, and then the ledger is distributed. So if somebody wants to change a value, they got to change the whole chain, and they got to change a copy of all these chains that everyone has a copy of. So very, very difficult, which is why it's very secure. Data integrity is very much assured. So let's look at this video here. I'll be quiet, let this video run on 6-minute video on blockchain to help fill some gaps and make sure you understand the technology.
Blockchains are incredibly popular nowadays. But what is a blockchain? How do they work? What problems do they solve? And how can they be used? Like the name indicates, a blockchain is a chain of blocks that contains information. This technique was originally described in 1991 by a group of researchers and was originally intended to timestamp digital documents so that it's not possible to backdate them or to tamper with them, almost like a notary. However, it went by mostly unused until it was adapted by Satoshi Nakamoto in 2009 to create the digital cryptocurrency Bitcoin. Now, a blockchain is a distributed ledger that is completely open to anyone. They have an interesting property. Once some data has been recorded inside a blockchain, it becomes very difficult to change it. So how does that work? Well, let's take a closer look at a block. Each block contains some data, the hash of the block, and the hash of the previous block. The data that is stored inside a block depends on the type of blockchain. The Bitcoin blockchain, for example, stores the details about a transaction in here, such as the sender, receiver, and the amount of coins. A block also has a hash. You can compare a hash to a fingerprint. It identifies a block and all of its contents, and it's always unique, just as a fingerprint. Once a block is created, its hash is being calculated. Changing something inside the block will cause the hash to change. So in other words, hashes are very useful when you want to detect changes to blocks. If the fingerprint of a block changes, it no longer is the same block. The third element inside each block is the hash of the previous block. And this effectively creates a chain of blocks, and it's this technique that makes a blockchain so secure. Let's take an example. Here we have a chain of 3 blocks. As you can see, each block has a hash and the hash of the previous block. So block number 3 points to block number 2, and number 2 points to number 1. Now the first block is a bit special. It cannot point to previous blocks because, well, it's the first one. We call this block the genesis block. Now let's say that you tamper with the second block. This causes the hash of the block to change as well. In turn, that will make block 3 and all following blocks invalid because they no longer store a valid hash of the previous block. So changing a single block will make all following blocks invalid. But using hashes is not enough to prevent tampering. Computers these days are very fast and can calculate hundreds of thousands of hashes per second. You could effectively tamper with a block and recalculate all the hashes of other blocks to make your blockchain valid again. So to mitigate this, blockchains have something that is called proof of work. It's a mechanism that slows down the creation of new blocks. In Bitcoin's case, it takes about 10 minutes to calculate the required proof of work and add a new block to the chain. This mechanism makes it very hard to tamper with the blocks because if you tamper with one block, you'll need to recalculate the proof of work for all the following blocks. So the security of a blockchain comes from its creative use of hashing and the proof of work mechanism. But there is one more way that blockchains secure themselves, and that is by being distributed. Instead of using a central entity to manage the chain, blockchains use a peer-to-peer network and everyone is allowed to join. When someone joins this network, he gets a full copy of the blockchain. The node can use this to verify that everything is still in order. Now, let's see what happens when someone creates a new block. That block is sent to everyone on the network. Each node then verifies the block to make sure that it hasn't been tampered with. And if everything checks out, each node adds this block to their own blockchain. All the nodes in this network create consensus. They agree about what blocks are valid and which aren't. Blocks that are tampered with will be rejected by other nodes in the network. So to successfully tamper with a blockchain, you'll need to tamper with all the blocks on the chain, redo the proof of work for each block, and take control of more than 50% of the peer-to-peer network. Only then will your tampered block become accepted by everyone else. So this is almost impossible to do. Blockchains are also constantly evolving. One of the most recent developments is the creation of smart contracts. These contracts are simple programs that are stored on the blockchain and can be used to automatically exchange coins based on certain conditions. More on smart contracts in a later video. The creation of blockchain technology piqued a lot of people's interest. Soon others realized that this technology could be used for other things, like storing medical records, creating a digital notary, or even collecting taxes. So now you know what a blockchain is, how it works on a basic level, and what problems it solves. Want to learn how you can implement a simple blockchain in JavaScript?
Okay, we'll stop the video here and we'll go on to hopefully this helped fill in some gaps and get you a better understanding of blockchain. So we talked about the internet, medical devices, medical things. We talked about 5G. We talked about blockchain. This combination, particularly of the internet of medical things and 5G, will create an enormous amount of data. And that data is not going to be something that a human can keep track of, this big data. So it's a problem because providers will be overwhelmed with data. Not something a human can manage. The good news is artificial intelligence loves big data. In fact, it needs big data. artificial intelligence, whether it's going through sort of a manual training, as they call it, in machine learning, or it's more automated. It needs data, or it can't get to the right probability of a correct answer. So the more data, the better. So this will lead us in healthcare to real-time decision support. So imagine, if you will, having a number of different devices, on your body or in your home, monitoring your health biometrics. You'll need some sort of home gateway, and this is an Amazon picture. Amazon's putting together a plan to be able to consume all of this data. So you'll have, whatever it is, your information from your smartphone that's collecting from your temperature sensors, or blood pressure, or heart rates, whatever it's collecting. This gateway that's envisioned will talk to the Amazon cloud, AWS IoT, collect all that information, use its own logic in sort of machine learning and artificial intelligence to then make sense of a problem. Look at this disparate information, structured, unstructured data, and send exceptions. Not all the data to the caregiver or the family member, but the data that's important, changes in your condition, a trend that's going down, some anomaly that's happening, and report on what's called an exceptions basis. Provide these alerts to providers. So this is really what we're headed. And of course, the medical decisions that can happen from this is, there's IBM Watson Healthcare and Stanford and others are looking at providing advice, not just the alert, but maybe being somewhat prescriptive. Also, predictive analytics based on your biometrics. Are you a candidate for a heart attack? Difficult diagnoses, a patient that has diagnosis that's difficult to determine. Artificial intelligence collecting all this data, of course, in conjunction with you visit a physician, but you're not always with your physician. You're not always in a hospital or in your doctor's office. The idea of this is to continually collect data and look for trends and correlations when you're not being seen by your physician, which is only about 5 minutes when you do go there anyway for a doctor's office visit. And then, Philips, I have a little video to show you too. Philips has partnered with with Amazon, and they're looking at millions and millions of radiological exams and making using some artificial intelligence to be predictive and say, okay, if you look at all these millions of exams and you look at this little anomaly, if there's a probability of some amount of this person developing, let's say, cancer. A human can't do that. A human can't remember millions of scans. A human won't go through millions of scans in their professional career, and it's going to be hard to follow. The provider, as a human, may not know the outcome of that patient, but the computer does. The electronic medical record will know what happened to you and can make those correlations and come up with diagnoses that maybe a human being wouldn't be able to manage. So when it comes to radiology, the prediction is artificial intelligence will be faster and smarter than a human. You'll have your radiological exam. By the time you put your shoes back on to leave, you'll have your results, and probably better than what a human can do. So these are just a handful of vendors: Microsoft, Amazon, Cerner, NTT in Japan, Salesforce, but there are many that are looking at how to collect this information from the Internet of Medical Things, how to make sense of it, how to use machine learning and AI to be able to report in a logical way what alerts are and some maybe predictive or prescriptive information to providers. So that's where we're headed. As far as Forbes, they're looking at where we're headed in 2021, about almost $7 billion spent for artificial intelligence investments in healthcare, and about $150 billion. If you look at the growth, that's pretty incredible from 21 to 2026. About $150 billion in application development for artificial intelligence in healthcare. It's rapidly growing. Providers, when they survey providers, they do see AI, artificial intelligence, as the most disruptive technology among any other thing they can envision for the healthcare industry. And I think you'd probably see why it would be very disruptive. So here's a video. I'm going to skip the first few minutes because he talks about this. This is the CEO of Philips, and he talks about his health and his father's health. And just in the interest of time, I'm going to skip the first few minutes and move you along to where he talks about what Philips is doing with Amazon to use AI to be more prescriptive and sort of maybe, I don't want to say replace a radiologist, but maybe in some ways supplement what a radiologist can do, but probably at some point in the future may replace a radiologist using AI and the ability to read a scan quickly and compare it to millions of scans that are similar or dissimilar. Okay, here's 4 minutes.
That today you can actually take all that information, but it's not easy, because I tell you, a digital scan is 500 gigs, a genome sequence is 500 gigs, and then we have all that data that comes streaming in. So how do you deal with those data? And then if you look at what we're doing at Philips, already today we have 190 million people in the hospital, in the intensive care unit, where we stream their vital signs to monitor them in an intensive care unit. Now what if we can take these algorithms and apply it to 50% of the population that live with those chronic diseases? And you've seen all the wearables. We actually talk about implantables now that allows you to wear a patient monitor anytime. We have 4 million people that have lung disease and that have ventilators. We're connecting those ventilators. We can help people control their breathing. We have 1,000 seniors with multiple chronic conditions every day being monitored at home so that they can stay together if it's an elderly couple, and we can help them. So tons and tons of data, or should I say exabytes. So today already we have 390 million studies, imaging studies, that we manage on behalf of our customers. Now what a treasure trove of data. What if we start applying deep learning to that? What if we can start comparing all these specialist notes that we collected around this? So what we're doing is we're creating this Philips Health Suite digital platform where we combine that data. We combine the data from the studies, from the images, from the electronic medical records, from the input that we get from our patients, and we combine that so that we can allow people to make it actionable. Because data alone is not enough. It's got to become actionable. It's got to become actionable for patients. I need to take my medication on time. Hey, I have chest pain. I need to reach out. It's got to become actionable for the care team. The guy has chest pain. I look at his vitals. We need to triage help here. So decision support actionable. If we have these thousands of markers that we have to interpret in real time, we need the intelligence in real time to deal with that. And it's got to be a great experience. It's got to be an experience for the consumer. It's got to be an experience for the care team that takes care of the consumer, and the specialist, the oncologist, the pathologist, the radiologist. So that's what we're building today. And we're doing that together with Amazon, because we're talking about adding a petabyte a month. A petabyte a month. And we're doing that around the globe in 100 countries. So there's only one company that we can do this, that gives us the reliability and the scale and the performance. And we're opening this up. We're opening this up in the next quarter to allow all of you to work with us to create the reinvention of healthcare, to help us deal with all these consumers like yourself, like your friends and family, and these millions of people out there that need our help to really, really change the way we provide care. Together with Amazon, we're going to do this on a global scale, and we're going to save lives together. Thank you so much. Thank you.
So I hope you found that interesting. I think this is just the beginning of where we're headed. Final thoughts. You all know Elon Musk, right? Tesla and SpaceX and the big dig company, and now he's got another company. He was the founder of PayPal, actually. Sold that and then had the capital to go into these other businesses. Well, talk about sort of artificial intelligence. There's always been a conversation of, will humans be replaced by AI? Well, Elon Musk has a new company called Neuralink, and what he wants to do is put a chip in your brain, and in the beginning, use that chip to help people who have neuromuscular problems, Parkinson's disease. There are implants now for this, but he's looking at, instead of 50 little electrode connections to your neurons, to tens of thousands. And what I really, to help a patient sort of control their Parkinson's or whatever the neuromuscular disease is. And what I got a kick out of this, when I saw the last bullet on the screen, he talks about making the implant on your brain about as simple as LASIK. And I thought, well, he's just a great salesman. But when you look at what he's done, he has a robot that does the implantation of the, and it's built already, the robot. I don't think he has any human trials yet. But he is going to make this, if it's successful, about as easy as LASIK. So he has this BMI, which I guess can be confused with other meanings of BNI, but brain-machine interface. And he says basically we are cyborgs, but we have a crude interface to our cell phone. He wants the interface to be mind to mind, your mind to the AI computer. So he's got a lot done. He's got the chip built. Here's a little picture of an implant. There's an external device that magnetically sits behind your ear that communicates with your cell phone, and to help folks with these problems. But eventually, the idea is to have a simple, instantaneous interface to not just to treat these patients, but for everyone to have brain enhancements, or anyone with these implants. So maybe this is the solution to keeping up with artificial intelligence and making sure we're not replaced, by AI. Sort of interesting. I just wanted to give you a sense of what he's doing, because I think it's going to change healthcare pretty radically. And on a final AI thought, here's an AI computer, and the professor, a scientist here, is saying good, cure cancer, bad, take over the world. And he's instructing the AI machine, who says, sure, I promise you can hook me up to the internet now. So let's hope for the best, and I hope you enjoyed this video and slideshow. Thanks for participating.